Good morning, everybody. It's great to see you all here, especially with the weather, and it wasn't very welcoming, was it, for those that have travelled into Sydney today and even those that were travelling within Sydney. But we thank you for being here, and we're really excited by the fact that so many of you do come to join us at this forum. We're hoping that you'll find that you'll learn something very practical and useful around the latest research and what those implications might be for you in your day-to-day practice. I'd just like to start just to apologise that our Aboriginal representative who is going to do Welcome to Country is unable to do it today. So I will do an acknowledgement to Country to start this proceedings this morning. So I'd just like to acknowledge the Aboriginal and traditional owners of the lands on which we meet today, pay respects to elders past and emerging. And today we're meeting on Gadigal land here in Sydney. And I'd also like to welcome any Aboriginal and Torres Strait Islanders who are with us here today. And in saying that, we really begin to think about how we can improve and work with the Aboriginal community and the work that we do in preventing falls and harm from falls. I just hope now that as we learn and discover on this journey together, that we do share with each other what our learnings have been, and we encourage each other in the work that we do and support one another and where we go to back into our real world. It's my privilege and honour this morning to present, excuse me, I do have a bit of a cough, Professor Jackie Close, to open this morning's proceedings. Jackie Close is a consultant ortho-geriatrician based at Prince of Wales Hospital, but also has an honorary position with Neuroscience Research Australia. I have quite a significant abstract here about bio with Jackie, but I am actually not going to go through it because it's quite substantial. But what I really want to say, in acknowledgement for all the work that Jackie has done since she's arrived here in this country, she has actually received a formal acknowledgement of that in the last awards that were given, and has now received and is a member of the Order of Australia. So I think we should congratulate her in that. Very proud. So I'd like to welcome you, Jackie. Thank you.
Good morning, everybody. As Lorraine says, I'm a geriatrician by training, but I'm also a geriatrician by practice. That's what I do, and fit in a bit of research in my spare time, which I continue to very much enjoy. When Lorraine asked me to do the opening remarks, I thought, wow, what a great honour. And then I started to think to myself, of all the conferences I've been to over the years, I don't remember any opening remarks from anybody. So I don't know how big an honour it is. The bar is low, so here we go. Could I have my first slide, please? Don't worry, I'm not doing a slide presentation, it's only a couple of slides. There we are. Yeah. So this is actually the 31st meeting of the New South Wales Falls Network. That's very impressive by any standards. It was started by Stephen Lord, my husband as it happens, another reason for getting to do the opening remarks. And of course John Ward, who's a retired geriatrician. At the time he set it up, he was also working at the Prince of Wales Hospital. So if you think back to, so those of you who are able to think back to 1993, Paul Keating was the Prime Minister. This network has survived and thrives through 9 Prime Ministers of Australia. In 1993, the top hit in the US was Whitney Houston's I Will Always Love You, Bodyguard, again for those of you old enough to remember. And an equaler for everyone. Ireland won the Eurovision Song Contest. In fact, Ireland won it in 92, 93, 94 and 96 and nearly broke the Irish economy. I appreciate that some of you weren't born in 1993. With a look around, I suspect some of you were still at school, but it clearly was a good year for these two guys sitting down, like-minded people, thinking, how can we make a difference from a practical perspective? And celebrating 31 years of this network has also made me think back to my practice. And a very sobering thought for me is next year will be the 30th year that I have run a falls clinic. That seems like a huge period of time that has literally just flown. But when this network first started, there were no randomized controlled trials that told us how we could intervene to prevent falls. So the reality of the two of these guys meeting to discuss things from a pragmatic perspective was really they were basing that information on what we had at that point in time, which were good studies, good risk factor studies coming through the 70s and 80s, but no randomized controlled trial evidence to support whatever recommendations were being made. I think the first thing that was done was to look at a home safety checklist to try and standardize it so that we're not all reinventing wheels. So they effectively set up an evidence-free zone. Everything was best guess, and it really wasn't until the 1990s and early 2000s that the bulk of the evidence that informs and shapes our practice now started to emerge. I think nutrition probably has come to the party later down the track, but certainly all the exercise, multifaceted, multifactorial, medication, etc. All of those trials predominantly came through in the late 1990s and early 2000s. And what we're seeing now in terms of randomized controlled trials is different ways of implementing strategies, particularly around exercise. See if I can push the next slide. In 1998, so I was still at King's in London in 1998. I was doing my thesis. I'd set up a falls clinic, and management came to me and asked me to write a falls policy to prevent falls in hospital. There was nothing available to me at that particular point in time. So again, I was no different to Steve and John, had to do best guess in terms of what I thought was likely to work or not work. So that's the algorithm I put together in 1998, and I've kept it ever since because I think most of it is still reasonably relevant. I think I'll probably take the screening out at this point in time. We're a little bit over screening, and hopefully we will move on from screening to better assessment and intervention. I didn't have much option, so I trained at the same time as David Oliver was training. He was at St. Thomas's. He's the guy who produced the Stratify tool. So I ended up with the Stratify tool in my screening. But in terms of, does it stand the test of time? Probably, and I think probably the most important part of that particular algorithm is the bit about does the patient have cognitive impairment or not, and your strategies really need to be very different based on whether they're cognitive impairment or not. So what about the successes of this network and falls prevention more generally in this state and in this country? Well, I think it would be fair to say that in this country, we punch well above our weight in terms of trials on exercise in Parkinson's disease, exercise in stroke, exercise in dementia, multifocal glasses use, footwear, foot care, medication review. And then for New South Wales, of course, the Stepping On programme has been enormous for us in New South Wales. But it's also important to remember that research is really just the first part of the journey, and we can applaud all of the research that has been undertaken, much of it very high quality. But it's actually about the implementation that's truly important, and that's what these networks are about. So this network has grown in strength and endeavour over the years, what Lorraine and her team have achieved. So Lorraine's been part of this journey for almost 20 years. What they've achieved through effective networking has been absolutely incredible. We have an army of falls prevention advocates, both in the research setting but also in the clinical setting in this state. And we've also watched Lorraine deftly navigate the complexities of policies and politics, which many of us hate. So we've got much to celebrate. We also need to be aware of the challenges that are ahead. Health is under enormous financial strain, and I can't see that changing significantly going forward. Each year, all of our local health districts and our organisations that are part of the state health are given efficiency targets. That's essentially a budget cut, but it is unpalatable to present it in that way. It's actually worse than Ireland's economic outcomes from Eurovision. We also have, as a result of COVID, loss of corporate knowledge. There's been a huge amount of churn in health, both at clinical and managerial level, and we're at risk of losing a lot of what we have learnt unless we successfully pass it on. And the reality for health is priorities change, and sustained funding is not guaranteed. The success of this network to date has involved some financial support. There's no guarantee it will be there forever. I don't know anything. I'm just suggesting that there is no guarantee of ongoing funding. I know in my own area, I've been told from the 1st of July that we will no longer be running a Stepping On programme after 20 years, and that I will be referring through the My Aged Care website for Stepping On. That sends a shiver down my spine. We have a report that came out 2022 from the Australian New Zealand Falls Prevention Society that continues to raise the alarm to do not assume that our funding will continue. We have to keep fighting for our services, the services that we currently have, but also the services we want for the future. We have to think big, and of course articulating falls prevention now needs to be in the context of preserving people's independence, keeping people at home, because that's what people want. And that move really to comprehensive care is probably the right way for us all to be going. Of course, the CEC produced its white paper last year and highlighted actually to us that currently New South Wales does not have a falls prevention strategy. So we are at risk. There is much to celebrate, but not to rest on our laurels. So what about the future? Well, 30 years on running a falls service, the people that I see are very similar. They might be a bit older. They come with the same set of risk factors, but what we're able to offer them in terms of intervention has changed dramatically, including also remembering bone health. We just need to make sure that falls don't fall off our radar, locally, state and national level. We have Lorraine and her team actively advocating at a state level. We have a Falls Prevention Society advocating at a national level, but that needs to be sustained. We'll have the updated falls guidelines later in the year, which hopefully will help those trying to work out where do you focus your energies in terms of most effective falls prevention. I guess in terms of health, so there's lots of good evidence out there about what we should do, but health is very slow to adapt and change and embrace different ways of doing things. The equipment that I use now is very similar to the equipment I used 30 years ago. We need to embrace the technological advances that provide opportunities for better, more comprehensive, objective assessment and for intervention. But some of those challenges in terms of getting things to change just seem interminable. Standing tall is a very good example of technology where you can have people exercising in their own home environment with an iPad, yet embedding that into health for Kim has certainly been challenging, and I suspect it will challenge her for many years still to come. Sorry, Kim. But implementation is absolutely key to our future. We have, and I know the researchers will never agree with me, but we have enough evidence out there to tell us what we need to do. It is the implementation that is absolutely critical in terms of moving forward. How do we implement to deliver interventions at scale to the right populations at the right time? So moving on to today. You've seen the star-studded programme of glitterati of the Falls world, really reflecting the expertise that we have in this state and country. It's always a delight to welcome Sally Lamb. She's not actually Australian, but I've watched her over the decades, and actually she started off in Warwick. She's moved to Oxford. She's now down in the south of England. I would have thought the next move probably is Australia. And we would welcome you if that was your choice, Sally. We've got a fantastic lineup of speakers sharing their research findings, but it isn't just the research that we're listening to today. It is as much about the networking that you do at the tea break, at the lunch break, learning from others' successes and failures, teaching and learning and exchanging ideas. I won't be at the panel discussion later in the day, but I think all of you should be thinking hard questions to ask the panel about how they are going to come up with solutions to make sure implementation happens and happens at scale in this state. And I'll leave you with the thought that when you wake up tomorrow, give some thought as to whether you remember anything I've said to you today. Thank you.
Thank you, Jackie. And if I could say one thing we might remember tomorrow morning, which is Saturday, and it's a long weekend, so I'm hoping that you're all going to be enjoying and relaxing and not necessarily reflecting on so much that you've learnt today. However, we hope that you'll leave from here remembering Jackie's comments that she's made through our history, but also you are the voice. And you're the voice of our future as well, so we would hope that you think about that and reflect on that and how you can be the voice for improving and driving changes in care. So thank you, Jackie, for that opening.